Welcome to Research Perch from the Massage Therapy Foundation. Short, practical insights into massage therapy research and how it can benefit your practice.
Hello, everyone, and welcome to Research Perch. My name is Adrienne Asta. I am proud to be serving as the president of the Massage Therapy Foundation. And today I'm really excited to have with us Spencer Pon. Spencer won our gold award for the student case report contest on his case report, Massage Therapy for Ankle Mobility and Spasticity in an Adult with Cerebral Palsy, a case report. So Spencer, I want to welcome you to Research Perch. It's great to have you on. And let's tell the audience kind of your origin story. First of all, what motivated you to go to massage school? Let's start there.
Well, it's a bit of a long story, but to sum it all up, I spent the majority of my 20s working all sorts of different jobs, and my longest career was actually in sales, but I was pretty unhappy, and it was just before the pandemic when I decided that I wanted to make a change. And for whatever reason, massage therapy just it felt like the right thing to do. Felt like it would open up a lot of doors down the road for me. And so that's when I made the decision to go back to school. I went to the MacEwan University here in Edmonton, Alberta, and got my career started in massage therapy.
Excellent. So is the case report a portion of the curriculum there at MacEwan University?
Yes. So the case report is written in the fifth term of a 6-term massage therapy program. And we actually write 2 of them. The first one we do in the 4th term, and that one is more of a practice run. We get used to writing, doing research, and formulating the case study. And then the one that I wrote for the Massage Therapy Foundation was the final paper for the program.
All right. And I'm curious, what was the connection to cerebral palsy? Is there a personal connection with that particular client? Or you tell us about how you got connected with this.
So typically, the students don't have a choice in the patients that will be selected. We are given 2 patients, and we end up writing the case study on one. In this particular circumstance, though, it was a friend of mine's in the program. His mother has cerebral palsy, and she had a very poor experience with massage therapy in the past, felt that she left with more negative effects than positive. But he thought that this would be a good opportunity to reintroduce her to the profession. And so she was willing to give it a second go, but he asked me if I'd be willing to take her on, simply because he trusted me and we had worked on each other a lot in the program. And yeah, when he asked me to do that, of course I said yes, and felt honored that he would ask me. And I selected this patient to write my paper on because it was more unique than the other patient that I had.
So tell us a little bit about your process of writing the case report. The amount of sessions that you did for this particular client, am I correct in saying there was 5 sessions over the course of 6 weeks? Am I accurate in recalling that detail?
Yes, so the treatment schedule is 6 weeks, so 6 sessions, but 5 treatments. And the first session is solely for the purpose of assessment and determining the patient's goals.
And what were your patient's goals for this particular case study? I know it's in the title, but the ankle mobility and spasticity component, there are a lot of mobility and spasticity issues for someone with cerebral palsy. It can manifest in different areas of the body, from what I understand. So what was the goal of this particular client or patient, as you call them in
Yeah.
Alberts?
So when she presented to the clinic, her first goal was to obtain some mobility in her ankles. She had no mobility in her ankles. They were rigid in plantar flexion. And her second goal, it first started out as she wanted to increase her ability to don her socks and shoes. And so it was on the initial assessment that I did, I observed her putting on her socks and shoes. And it was then that I determined that it was spasticity that was negatively affecting that. And so we worked together to create the goal of decreasing spasticity in order to help improve her function.
So aside from donning socks and shoes, which is, a very important activity of daily living, were there other activities of daily living that she was suffering from this particular aspect of her condition?
The ability to don her socks and shoes was the primary concern. It did also affect her ability to drive, but she did have some changes to her vehicle where she had paddles installed on the steering wheel, which allowed her to drive.
Right. What was the most challenging part for you about writing a case report?
In this particular one, the most challenging part was that there seemed to be a lack of research done with massage therapy and cerebral palsy. I found a few studies that were done on children, but I was having a hard time coming across any research done on adults. So I felt like I didn't have a place to start, and not having a place to start or previous research to refer back to, I think that was the hardest part.
So given the paucity of massage research, what were the treatment choices that you made with this particular client? Walk us through the treatment.
Yeah, so the treatment plan itself consisted of a pretty standard Swedish massage, I would say. There was a lot of consideration done on the order of the techniques selected, but all of them, for the most part, stemmed from general Swedish, and all of them were done with the intent of calming her nervous system down, increasing blood flow to the area, and trying to have a positive effect on the affected tissues. Towards the end of the session, when I started to do more specific techniques, I incorporated, Golgi tendon organ release on her Achilles and some joint mobilizations to her ankle. I did distraction of the talus at the talocrural joint and some anterior gliding of the talus as well.
What were some step-by-step progresses that you saw from session to session? That's something that's particularly interesting to me as a practitioner with a client or patient that we see over a series of weeks, is that the progress rarely is linear, at least what I see in my treatment room. Like, we have a good day, we have a less good day, and a great day, and maybe a decline. What was something, I know 5 weeks isn't a really long period of time, but can you walk us through kind of the progression of her progress as you went through the 5 weeks?
So in regard to her ankle mobility, her progress was fairly linear, actually. So I used goniometry to measure her ankle mobility, and the patient was seated on the table Her lower legs were dependent, so they were unsupported, and her feet were dangling. And it's important to point out that I ended up measuring her ankle position because she had no mobility. So what we saw over the 6 weeks was her ankle would relax further into plantar flexion. And post-treatment, I was able to passively move her ankle back to the starting position. So week to week, her ankle started further into plantar flexion, more relaxed. And after each treatment, we would see that joint relax further, which would allow for more passive range of motion back into dorsiflexion of her original position.
Great. Did you measure active range of motion or resisted range of motion, any other types of range of motion that you used?
I did not, and that was solely because she didn't have any active range of motion. When she went to move her ankles, there would be some slight toe movement until the final session. Actually, she gained the ability to slightly active dorsiflex and plantarflex her ankle.
Excellent. If you had more time with this particular patient, what would your next 5 sessions look like?
The next 5 sessions, I think I would start to include a little bit of heat at the beginning of her session. I recommended that she use heat for home care at home, and she said that she responded well to it. So I would have started to incorporate heat at the beginning of the sessions, and I would have allowed myself more time to do some joint mobilizations on her.
Okay. If you had any advice for somebody who is looking to, maybe somebody got introduced to a client with CP, based on the work that you've done with this particular client, what are some bullet point recommendations that you would say, some kind of like the top 3 things?
I think the first and most important thing would be to listen to the patient or client. Their feedback is very important. The second thing I would say is be careful with the depth of the treatment. Anything too vigorous, we don't want to stimulate her sympathetic nervous system, because that can really have a negative effect on spasticity. And also, I would say not to be discouraged if you don't see results, because there are a lot of outside factors that can affect what we're seeing in these patients. I know stress had a huge impact on the spasticity in this individual's life.
Okay. Were there other things besides stress, other outside things? I mean, stress is a pretty, kind of overall umbrella that kind of compounds all of the other things. But did she mention anything in any of the follow-ups, or this patient?
Just that if she would overdo it while doing housework, that also seemed to flare things up for her.
Right. Going through this process of writing a case report, can you talk about how important this process was of writing the case report is, or the process was to your current work now?
Yeah, the biggest takeaway for me is the critical thinking skills that it has helped develop, formulating individualized treatment plans with intention, purpose, and with an end goal in mind.
When you were writing your conclusions and your recommendations for further research, what were some points that were included in your paper?
The biggest point was that researchers should be encouraged to conduct further studies regarding the efficacy of massage therapy as a treatment for cerebral palsy. In a short time frame, 5 treatments, we were able to introduce some ankle mobility, and we were able to reduce spasticity as well. We didn't see any clinically significant results, but subjective comments from the patients and reported improved function. They're all promising results when we consider the chronicity of this patient's condition and decades of limitation. I also think that a larger sample size would be beneficial. Most of the studies that I came across with children involved closer to a couple dozen. So a larger sample size, I think, would help us gain more comprehensive data and help massage therapists formulate treatment plans for those with cerebral palsy in the future.
If you were to talk to another fellow massage therapist about writing a case report, what would you say are some of the things that they need to be aware of? One of the aspects of why we want our massage therapists to write a case report is because it gives us the level of evidence that you're seeing. And if we do that across multiple practitioners across the globe, then we can start doing those higher levels of research that we all need and are looking for, and that our allied health professionals are looking for. And I do know if it's not in the structure of a curriculum like you had at McEwen, it could be a little daunting for someone to try this on their own. And we at the Massage Therapy Foundation do have resources for them. But if you could talk about your personal experience from, lit review to conclusion, what can somebody expect to experience over that time?
Well, the guidelines that the foundation had laid out were very helpful in the process of writing this. So I'm very grateful for that. I would say don't get too caught up in trying to achieve positive results. No results, or even seeing results going the other way, can be valuable to our profession. And I think patience when you're doing research, patience when you're with the client, and patience when you're formulating the treatment plan. I think really taking the time to analyze your intentions and goals, and then working in line to create a treatment plan that's aligned with that.
Excellent. If you had to do this case report again, is there anything you would do differently? It's hard to say because hindsight's 2020, right?
If I were to do anything differently, I think I would allot more time towards working on her ankle joint.
So were your techniques whole body techniques with just extra time in that area versus all focus time on the ankle?
My treatment included everything from the waist down in those 60 minutes.
Okay.
with focus on the knee extensors and her calf muscles.
All right. And then if what's next for you, Spencer? I know we're trying to get this, you're trying to get this paper published in the International Journal of Therapeutic Massage and Bodywork. The IJTMB is, is our Massage Therapy Foundation, and the RMTBC, supported by the RMTBC. It's a open access, peer-reviewed, PubMed Central indexed journal. So that's a high quality and high level journal. So what is it like going from writing the case report to publishing it in this very prestigious journal?
Well, it's interesting because it starts out as an assignment in school.
Mm-hmm.
And at the time, there's thoughts that this can go further, but your intention when writing it is not necessarily to publish. So as this has progressed, it's interesting. It's challenged me in a lot of ways. You can't just write something in there willy-nilly. You have to have evidence to back up what you're trying to say. You have to be very clear with your intentions. And you'll also have to be able to articulate those intentions and goals.
That I think that was my next question is, how do you feel this work and other case reports add to that scholarly conversation for not just massage therapists, but researchers?
Even examining a single individual, this process has shown can be valuable. And it's pretty amazing to think that it can be valuable to such a large and growing profession.
We do have our Massage Net is the Massage Therapy Foundation's practice-based research network, where we're trying to have meetings informally, even just like kind of this conversation that we're having now, just not only massage therapists, but anybody who might be working in looking at research for for not only this condition but other conditions. So really, this process can help us understand the results. And I like how you said, any result is information, right? And that's kind of a shift for some people, because if the outcome maybe is worse than what they came into the treatment room with, we think we fail, right? When in actuality, we shouldn't judge it, right? There's no judgment. Did you experience any negative outcomes in that 5 weeks or 6 weeks?
There was 1 week where, when I was administering the modified Ashworth scale test on her, that there was an increase in spasticity. The MAS score was the same, but just anecdotally, as I was administering it, I did feel an increase in spasticity. So that was a little bit discouraging. But that was also the week where she had mentioned that she was under a little bit more stress and that she had increased her activities around the house as well.
For those listening who are not familiar with the assessment that you did, can you talk a little bit about it?
Yeah, so the modified Ashworth scale is used to assess spasticity in those with upper motor neuron lesions. And it's done by taking the corresponding joint to a position of relative muscle shortening, and then in 1 second, bringing that joint to full relative lengthening.
And then based on what are you looking for in the result of that?
So the scale goes from 0, which would be no resistance or increase in tone felt, all the way up to a 5, which would mean that that joint is rigid in either flexion or extension.
And what was this particular patient's, where was that on that scale that day?
So she remained a 3 throughout the entire 6 weeks. With the improvements, it wasn't enough to bump her down to a lower level. And then also the week where it got a little bit worse, it wasn't enough to bump her up a number.
Got it.
But on the administration of it, I could feel a difference.
Excellent. Thank you. So, Spencer, what are you doing now? Like, tell us a little bit about your current practice.
Right now, I'm working out of a chiropractic and wellness center. We offer chiropractic, acupuncture, and massage therapy here. I've recently become a specialist in a technique called rapid neurofascial reset. So I've been focused on building my business and incorporating a lot of that into my treatments. And then coming up here in just a couple weeks, I'll be in Tampa presenting at the AMTA National Convention. So I'm very excited to share what we've been talking about here today, but in front of a live audience.
Yes, excellent. If you are going to be in Tampa at the AMTA National Convention, make sure you pop over to the research panel where Spencer is going to present a little bit more deeper detail about his case report, and you can feel free to ask him questions. There's going to be time for that. And just to let everybody know, the Massage Therapy Foundation has lots of resources for you. Thank you to our donors and sponsors. Case reports are what help us to, understand our results. And it's that conversation, right, that keeps us, that keeps us moving forward in our profession to be able to give that client the best treatment. So just to let everybody know that you are making a difference in the treatment room, and the case report helps us to tell our story about what's happening in real time in our environment, done by licensed practitioners like ourselves. So, Spencer, is there anything about the case report that I'm not asking that you feel like you need to punctuate before we get going?
The biggest thing for me is that even though there were no clinically significant changes when it came to the modified Ashworth scale and the spasticity of this person's knee extensors, I don't think that her subjective experience should be overlooked. This patient, week to week, noticed improved ability to don her socks and shoes. So even though the scores on the MAS did not change, the person's life did change. And I think that's why we all do this.
Impactful, and thank you for the work that you do. So thank you very much, Spencer Pon, winner of the gold winner of the Student Case Report Contest. My name is Adrienne Asta. I am the president of the Massage Therapy Foundation, and this has been Research Perch. Thank you, everybody. For more information, log on to our website at massagetherapyfoundation.org.
If you enjoyed this podcast, please consider donating to the Massage Therapy Foundation so that we can continue to bring you this and many other resources to increase your knowledge and improve your practice. Thank you.